right?
Ever since Paul Ewington was diagnosed with ALS 4 years ago, he started losing his ability to care for himself. Most of the burden now falls on his wife.
I don't know how we manage, by the skin of our teeth some days. I'd say we have some family help, and we're lucky, our son and our daughter on the weekends.
The couple gets a bi-weekly visit by a support team.
Is it because you're sliding down?
Death is not imminent, and it's not clear how long he has to live. But his circumstances are challenging the traditional definition of palliative care.
What is palliative then? Is it somebody who's, you figure they've got 3 months, 6 months? With ALS, you don't necessarily know that.
The concept of palliative care in Canada grew out of necessity to manage terminal cancer patients in their final months. But a new report says Canada is falling behind other developed countries when it comes to opening up access to other types of patients like Ewington.
The vast majority of Canadians are not going to die of cancer. They'll die of one or more chronic illnesses that we can treat and often keep under control for a very long time. But the patient may still have a lot of symptoms and have a lot of need for support, not just arising at the end of life, but as I say, for many months or years prior to their death.
Dr. James Downer says too many expensive acute care hospital beds are tied up by chronically ill non-cancer patients, patients experiencing organ failure or frail older people. And the answer isn't simply more money. Rather, it's expanding community-level palliative care, as well as introducing mandatory palliative care education for all medical professionals.
So the irony is that we could, with better funding and moving some of these resources towards palliative care, actually deliver much better end-of-life care at a lower cost.
In 2 decades, it's estimated a quarter of Canadians will be seniors. With that in mind, the Trudeau government says it will work with the provinces and territories on a new health accord. Vic Adopia, CBC News, Toronto.